Martino, and I'm an orthopedic surgeon here at Carillion Clinic in Roanoke, Virginia, specializing in hip and knee replacement. This video is an explanation of what is entailed in a hip replacement surgery. A little bit of background about me. I went to medical school at the University of Florida in Gainesville, Florida. I then did a year of general surgery internship at UC Davis in California. I then did my orthopedic residency for 5 years at University of Missouri in Columbia, Missouri, and then did my fellowship in adult reconstruction, which is advanced hip and knee replacement here at Carillion Clinic in 2017 and 2018. I then went into private practice for 2 years and then returned to Carillion Clinic in 2020. Here at Carillion Clinic, we train 2 fellows in adult reconstruction per year and also train 4 residents in orthopedic surgery per year. This video is an explanation of what is entailed with a hip replacement. This video is designed to be the surgical discussion that I classically have done in clinic with patients. After you watch this video, you will have 3 different options. One option is that you can schedule an appointment with me in the office and I'll be happy to answer any questions you have. The second option would be that you got all the information you needed from this video and do not need an appointment at all. And the last option would be that we could schedule a phone call visit after you watch the video where I answer your questions over the phone. Most of the information in this video is also explained in detail in a handwritten form that I gave you in the office and should be in your information that you have for the surgery if you prefer to have it in written form. Many of my patients ask me what arthritis is. There are many people who assume that arthritis is something that grows inside of a joint. Before I discuss arthritis, we will talk about what a joint is. A joint is an articulation between 2 bones in your body. Your hip joint is one of the major joints in your body, and your knee joint is another major joint in the body. The hip joint is an articulation between your thigh bone, also called your femur, and a portion of your pelvis called the acetabulum. In the picture on the left, we can see a normal hip joint. This bone right here is the thigh bone coming up to what we call the femoral head, which is a ball that should be round. And then the acetabulum is a socket inside the pelvis, and this white line right here is the acetabulum, and it typically runs around about half of the ball. The rest of this is the pelvis bone itself. The hip joint, therefore, is this space right here between the ball and socket of the ball and socket joint. A normal hip joint has space between the socket and the ball. We're talking about this space right here between those two. That space is full of 2 things. One is called the cartilage, which is the protective padding between the ball and socket of the hip joint. And then the other thing is called a labrum, which is a gasket that runs 360 degrees around the socket and the ball in order to help provide a suction seal to the hip joint and protect the hip joint from a stability standpoint. The normal thickness of the space between the ball and the socket is several millimeters of cartilage and typically is about the thickness of the tip of my pen. So here on this hip X-ray on the left side of the screen, that is a normal space between the ball and socket, and that's what you want. You can contrast that to the hip X-ray on the right, which is an example of somebody who has bone-on-bone right hip osteoarthritis. This is the thigh bone coming up here to the ball. You can see the normal socket bone, which is right here. But between the ball and the socket, they no longer have that nice thick padding of cartilage between the two and have worn out at least 90% of that cartilage. That wearing out of the cartilage or loss of the cartilage is osteoarthritis in this patient. And we would label that as severe or bone on bone in this patient. Arthritis can be graded as either having no arthritis, mild arthritis, moderate arthritis, severe arthritis, or bone-touching bone arthritis. Bone-on-bone arthritis is a specific grade of arthritis that we designate based off of X-rays, and that is what this patient on the right-hand side has. In order to be a candidate for a hip replacement due to arthritis, You typically need to have moderate to severe arthritis in your hip joint, though some people will get hip replacements for other reasons without having as advanced of arthritis. This is an X-ray and a 3D modeling of a hip replacement. The metal rod that goes down the inside of the thigh bone is this thing right here, and this is the inside of the left thigh bone. This is an X-ray of what that metal rod typically would look like on the X-rays after the surgery. On top of this metal rod sits a ceramic ball that replaces the ball that got arthritic and was cut out during the surgery. That ceramic ball is pink on this diagram, and that's this thing right here. The metal cup that sits inside the pelvis is this right here. On the diagram, it's the silver rim right here that runs around the ball. And then on the diagram, you can see the piece of plastic that is the bearing of the hip joint, which is this white liner inside the metal cup. And the pink ball sits inside that white liner to give back the ball and socket joint. You cannot see the plastic liner on the X-ray, but it's the reason why there is this gap between the inside of the metal cup and the ceramic ball. And that piece of plastic runs all the way around the ball inside the metal cup in order to act as the bushing, bearing, or new cartilage in the hip joint. Hip replacement is an excellent operation. This is the most successful operation that we do in orthopedic surgery in terms of patient satisfaction and patient outcomes. It was described as being the operation of the 20th century. The only operation in the whole world of surgery better than hip replacement is cataract removal in terms of patient satisfaction and patient outcomes. So even though hip replacement is a major surgery, it is typically a very successful one. Our goal here at Carillion Clinic is to ensure that you have the best success that you can have and heal the best that you can. By definition, a hip replacement is the fix to hip arthritis. After we do a hip replacement, you can no longer have arthritis in the hip that we have operated on. So the arthritis can never come back after the operation. A hip replacement entails cutting out the arthritis out of the hip and then replacing it with metal and plastic to give you a new ball and socket joint in the hip. We do these operations at 2 hospitals here in Roanoke. One hospital is Roanoke Memorial Hospital, and the other hospital is Carillion Community Hospital downtown. On the day of the surgery, you will come into whichever hospital you are having surgery at that morning. We'll do the operation, which typically takes about an hour and a half, and then you'll go to the recovery room for about an hour and a half after the surgery. Your family will have about a 3-hour wait from the time that you leave the pre-op area until they can be with you again in a hospital room. Once you leave the recovery room, you will go to a hospital room. You'll be up walking on that leg the same day with a physical therapist typically. The therapist will typically show you how to use a walker, have you exercises to do for the hip, and have you go up and down stairs if you need to do that to get around your house. Once you are safe and have met all of our goals, we will get you home. We don't send patients to nursing homes or rehab hospitals after these surgeries, as you are much safer medically at home after a hip replacement. We do need you to have 24-hour care for the first 7 days after the surgery. We will be asking you who will be helping you after the surgery. Currently, about 80% of people go home the day of the surgery, and then the other 20% typically go home either the next day or some other day after that, after having spent a night in the hospital. But this is not a choice. Once you are safe and you have met the goals, we get you home. Once you are home, we will typically send a home health physical therapist to your house for the first 1 to 2 weeks after the surgery. They will work with you on exercises, walking, stairs, getting in and out of your car, all those types of things. There is no set course for how to recover after a hip replacement. The therapist is there to help guide you on your recovery, and everyone will achieve different things at different times. After the first 1 to 2 weeks of therapy at home, we will then transition you to outpatient therapy, where you pick an office that you want to go to near your house and you go do more therapy. Typically, between the home therapy and outpatient therapy, my patients will do between 6 to 8 weeks of therapy after their hip replacement. In terms of driving, we don't recommend that patients drive at least for a little bit after the surgery, but my team and I will not clear you to drive. You can decide when you're ready to drive when you meet the following criteria. First, you needed to have no weight-bearing restrictions after the surgery. That would be atypical, and that would be noted thoroughly during the hospitalization and on your paperwork after the hospital. You need to be off any of the narcotic pain medications that we give you for the pain after the surgery. And then you need to feel safe to drive. Once you meet those criteria and you and your family feel that you are ready, you can return to driving. But once again, my team and I will not clear you to go back to driving. The average recovery after a hip replacement is 3 months. And when I say recovery, what I mean is that by 3 months, most of the muscles and tendons and ligaments have healed back around the hip from the surgery. By 3 months, most people who work have returned to work. Most people could take a vacation. You could go shopping for the day or push mow a yard, do those bigger activities. Those first 3 months are actually 80% of the full recovery. The next 9 months after that are the last 20% of the recovery, which is typically about building back strength in the leg as well as improving your stamina. So this is actually a year to full functional improvement in your leg, though the first 3 months is the majority of that at 80%. Returning to work is a very individualized decision. You know your job better than anyone else. I will not tell you when you are safe to go back to work, but we will have a discussion about when you are ready to return. Most people who work from home can typically return to work within 1 to 2 weeks. Most people who work in an office could go back to work safely around 4 to 6 weeks. But people who work in factories or work construction typically take 8 to 12 weeks off of work. Those are averages, and once again, when you feel ready to go back to work, we will typically get you back to work. If you have FMLA or Family Medical Leave Act through your job, we will typically fill out FMLA paperwork for you to take 3 months off of work after the surgery, and if you can go back to work sooner, that's great. If you need the typical 3 months to heal, that's fine. We typically do direct anterior hip replacements here at Carilion Clinic, also called anterior or DAA hip replacements. That involves an incision on the front of your thigh, up near the hip joint. It's not right in the middle of the thigh, but a little bit to the outside of the middle of the thigh. And the incision is typically about this long. That allows me to go down to the hip joints through the muscles. This is called an internervous and intermuscular plane, where we do not cut any muscles or detach any muscles from your thigh bone, and are able to perform the hip replacement through that incision. In terms of risks of surgery, I'm going to tell you some of the common risks with some percentages that are averages, though individual circumstances and medical comorbidities may increase or decrease your risk of these individual complications. In terms of the risk of infection, the risk is generally less than 1% over the course of your entire life. Theoretically, I could injure a blood vessel or a nerve in your hip, though I have never done that, and I do not want to start at any point. So we protect those nerves and blood vessels throughout the surgery. One thing that patients will get, though, from the skin incision itself is a numb spot on the outside part of the incision, or what we call the lateral side of the incision, and that will typically go away. For the majority of people, that numbness will go away by a year, though some people will have permanent numbness on the outside or lateral part of the incision forever. There is a possibility that you could bleed to the point of needing a blood transfusion. That risk is typically less than 1%. There is a possibility, also less than 1%, that I could break one of your bones during the surgery. If I were to break something, I would fix it. But I won't call your family and ask their permission. I would just take care of it, and I would tell you about it afterwards. That may change your recovery or your ability to put your full weight on the leg right after the surgery. There is a possibility of something called a dislocation, where the new ball that we put in your hip comes out of the socket. The risk of that with an anterior approach hip replacement is typically quoted as being 0.4% or 0.4%, which is less than 1%. If you have more than one dislocation, you may end up with other surgeries to try and prevent that from happening in the future. Blood clot risk is generally about 0.5%. We will ask you to take a blood thinner for 6 weeks after the surgery. Some people feel that one leg of theirs is longer than the other. Typically, the leg that has arthritis will get a couple of millimeters shorter than their non-surgical leg as they wear through the cartilage. This is because as you wear through that cartilage, you are actually physically losing material and your leg is getting slightly shorter. With a hip replacement, we typically aim to give you back those couple of millimeters of length in order to make your muscles the correct tension so they can work most optimally. Because we lengthen those muscles by those couple of millimeters, you may feel like your surgical leg is longer than your non-surgical leg for the first couple of months because those muscles have been stretched. After the first 3 months, when those muscles recover, that feeling of length typically goes away and your leg should feel the same. However, leg length differences after hip replacement are common, and many patients don't have equal leg lengths to start with. Part of your workup will include an x-ray called a joint survey, where we measure your leg lengths directly, and we may need to talk about your leg lengths before and after the hip replacement. Typically, I ask patients not to wear a shoe lift on their surgical leg for the first 3 months after the surgery, because we want those muscles to be able to recover and the body to acclimate to the new feelings of the hip replacement until the first 3 months are over. From a longevity standpoint, for patients over 65, a hip replacement should last them the rest of their life. So for patients over 65, over the next 30 years, they have about a 30% chance of more surgery on their hip for any reason. So 30% over 30 years means that about 1% will fail per year. For patients younger than 50, that is likely a higher failure rate over 30 years. For people younger than 50, this operation may not last you the rest of your life. For people between 50 and 65, there is a better chance it will last you the rest of your life, though individual circumstances may make the hip wear out faster or may lead to a revision surgery sooner than people who are older. I wanted to thank you for taking the time to watch my surgical discussion video. This video contains the information that I think is important for patients to know before they undergo a hip or knee replacement. That being said, you may still have questions that I did not cover in the video. Just to reiterate, there are 3 options for how we proceed prior to your surgery after you watch this video. The first option would be that all of the information that we have given you, including this video, has answered all your questions, and you do not need an appointment with me in the office. If that is the case, then you will just have your pre-surgical appointments and will not need to see me until the day of the surgery. The second option is that you may still have some questions after reading the materials and watching this video. In that circumstance, you could schedule a telemedicine visit with me in order to go over your questions over the phone. I'm happy to answer your questions over the phone in this circumstance, though you may have a small co-payment with your insurance for that telemedicine visit. The last option would be that you still have questions that you would like to have answered after reading the materials and watching this video, and you do not think that they'd be amenable to discussing over the phone. In that circumstance, I'm happy to see you back in the office prior to your surgery with an in-person visit, and we can go through your questions. Just like with a telemedicine visit, you may have a co-payment for this visit, but I'm happy to sit down and answer your questions prior to your surgery. If you do wish to schedule either a telemedicine or an in-person visit, you can either contact my staff through my chart or by calling the office number, and we will get you set up with an appointment prior to your surgery with me to answer your questions. I would like to thank you for trusting me to be your surgeon for your upcoming joint replacement surgery, and please know that my team and I will do our best to care for you as if you were a member of our family.